a minute.
That's okay. We could talk about the weather in Minnesota. That's a perennial topic. Feels like March today instead of May.
Here we are.
That's the slide I like. Great, thank you.
You're welcome.
All right, okay. These 8 grassroots organizations had multiple targets over the 3 years. And what's kind of interesting is often their partners were their targets, and they would work together towards a similar goal. While they had so much, I would just like to highlight a little bit of their work. The Alliance for Metro Stability is a coalition of community organizations focused on building shared power and campaigns for equity in economic and housing development. They targeted cities along a future light rail line to assure community voice was included in future development. As we heard on the video, Asian Economic Development Association seeks to increase economic opportunity for low-income Asian Americans in the Twin Cities. ADA targeted the City of St. Paul's comprehensive plan to assure low-income residents' interests and needs were included in the plan. Hope Community is engaged in community leadership development and community capacity building. Hope targeted the Minneapolis Park Board by strategically organizing community members to drive sustainable, equitable changes in decision-making, investments, and programming in the Minneapolis parks. ISAIA is a multiracial, statewide, nonpartisan coalition that works on economic and racial justice. ISAIA organized faith-based coalitions in greater Minnesota and supported leaders to engage with elected officials and police. The Nexus Community Partners engages communities and cultivates power through leadership development. Nexus worked to advance a Green Zones ordinance in Minneapolis to ensure it included financial allocations, health equity data, and measures of success. Voices for Racial Justice empower communities of color and Indigenous communities. They worked to develop cohorts of organizers and conducted conversations around racial equity in the Twin Cities and throughout greater Minnesota. The Zeitgeist Center for Arts and Community is an arts and community development organization that is tackling huge health disparities in the city of Duluth. If you're African American in West Duluth, your lifespan is 12 years shorter than those of your white counterparts in East Duluth. Zeitgeist led a health equity coalition that targeted the city's Duluth comp plan, schools, and hospitals. And lastly, the Hmong American Farmers Association builds wealth for Hmong farmers by building partnerships and fostering community development. HaFa took a place-based approach and targeted food procurement policies in anchor institutions in East St. Paul to increase access to healthy, culturally appropriate food for the residents. Now you can see that these organizations were already engaged with the community to support leadership and build power. We provided funding, technical assistance with communications and evaluation, and the flexibility to let them drive their own work. I'll now turn it over to Anna Isabel, who will talk about evaluation.
Thank you, Sue. Next slide, Rachel. As Sue mentioned, we were funding this initiative in a different way. So we also recognized our evaluation needed to be different too. The evaluation centered on understanding how a Minnesota health and all policies approach that is community-led works. We funded community-based organizations that have been working on addressing social determinants of health for years. So we supported them to continue the work they do best and take it to the next level. The work that these organizations do is complex with many different moving parts. More importantly, they center equity, race, and community to make systemic changes that allow for equitable policies and practice. In the evaluation, we wanted to learn how these organizations do the work, what can we learn from it, and how can we best support them. Our approach to evaluation was both a developmental evaluation and utilization-focused evaluation. Utilization focus means that the primary intended users of the evaluation are active participants, and it also means that we had a clear plan on how to use the evaluation results. Developmental evaluation means that the evaluation is collaborative and participatory of the primary intended users. We build intentional opportunities for learning and reflection, and the evaluation develops and adapts with the project. So this means that if there's a goal of the project that changes, the evaluation goal for that project changes too. In addition, the design of the evaluation was co-created with the funded communities. They developed their own goals, their targets, and together we developed the evaluation questions, increasing funded communities' engagement and investment in the process and evaluation results. Next slide, please. In the evaluation, we learned that funded communities were primarily using 4 core strategies to do their work. We'll now see a short animation video of these strategies. Thank you. Next slide. So in this mapping, we can see how the core strategies work together. Build power collectively, activating community leadership, building decision-maker capacity, and transformation for racial justice. These core 4 strategies work together to impact on racism, the process of policy making, policies themselves, and implementation of policy. The 8 funded organizations were using these core strategies to do the work at varied levels. In using these core strategies, organizations are creating an ecosystem to support the work. The end goal is as important as the process to reach the goal. As you will see in this presentation, I will focus more on our findings on how the organizations were doing the work and achieving a health and all policies approach, knowing that if the foundation of the process is well executed, the outcomes will come with it. In this mapping, the role of community leaders is essential. The blue circle is big in the map. Community-based organizations are activating community leadership, building their base, supporting community strengths and skills. They're building community power collectively. Community-based organizations collaborate and partner with other organizations, taking the time to build relationships and understand the system. Both community leaders and community-based partner organizations work together with decision makers in supporting their understanding and impact of the issue, asking and influencing who and how are decisions made. Transforming for racial justice is both a goal as well as an approach to achieving health and all policies centered in equity and centered in community. Healing justice, as you can see, is also pretty centered to this map. Healing justice works is really, really central to the ecosystem. It focuses on the fact that systems were rooted in oppression and racism, and when working with these systems, harms created by the system will surface in the process. Some of these organizations used healing justice as a strategy to minimize harm experienced by community leaders, to create protecting mechanisms to support themselves and their work, while working with the system to make sustainable and equitable changes. Hope Community used healing justice as an intentional strategy to get institutional partners to understand their impact and change their practices. I will now talk about each of the core strategies in more detail. Next slide. Community-based organizations activate community leaders in a systematic and rigorous process. Step 1 and 2 are about creating a space and opportunities for involvement, offering childcare, food, compensation, and paying close attention to what community leaders need, what they're interested in, and what they want to learn. The next steps are about providing them with opportunities to build their skills, increase their awareness and understanding of the system, and providing them with opportunities to act and move into deeper leadership roles. The last step is about preparing them for the public arena, addressing power and privilege, historical trauma, and applying healing justice. An example of activating community leadership is the work that Voices for Racial Justice was doing. Throughout the process of this initiative, Voices had the time to ask questions, reflect, and change the way they activate community leadership in Greater Minnesota. One of the places that were activating leadership was in Worthington, Minnesota. Before they started the work, they conducted one-on-one conversations with community leaders to really understand what barriers were they facing, to learn what they wanted to learn and how they wanted to work together. They learned that community leaders of color in rural areas face isolation and discrimination, and that in order to be successful at supporting their efforts, their project had to be comprehensive, creating a safe process for them to organize. As a result, they created a cohort of leaders who would learn together, co-created the curriculum, and executed the work together. Next slide, please. Healing justice is an integral part of how Voices addressed and works with communities. Healing needs to be addressed before jumping into advocacy. Voices supported cohort leaders to build in self-care and healing practices, find ways to recharge, and keep motivated and engaged in the work. And also the importance of storytelling, both hearing from others and telling their own story. Healing builds understanding and connections that create confidence, strength, and power. Activating community leadership goes hand in hand with our next strategy of building power collectively. Next slide. In building power collectively, community leaders and organizations support the connection and convening of community to be part of the decision-making process, value and amplify community and place-based solutions, collaborating and partnering with other organizations to build power together. An example of this work is the Alliance and their work with the New American Development Center and their leader, Assad. The city of Eden Prairie had consistently ignored housing complaints by the growing Somali community. The Alliance connected the New American Development Center to existing housing advocacy organizations, to the city human rights commissioner, and supported them in understanding how to navigate the system, learning the ins and outs of city decision-making. Using their new partnerships and knowledge, the New American Development Center convened a community forum to educate city officials on housing concerns, and they built close relationships with the Human Rights Commissioner. As a result, they presented the city of Eden Prairie with a list of recommendations of how to do equitable housing, and currently, anytime the city wants to work on housing, they actively seek their feedback and engagement. Next slide, please. So the work that the New American Development Center was doing with the Human Rights Commissioner included supporting her capacity to understand the needs of the community and how to best support them. The Commissioner has taken opportunities to learn about her privilege and how to act in support of communities she serves, centering equity. The work of building decision-maker capacity is often overlooked. It takes a lot of time and effort, and is usually work that is not funded. Some decision makers don't understand equity, they don't understand how racial bias affects decision making, or how health and all policies centering equity addresses structural racism and social justice. Community organizations play an important role in building decision maker capacity by providing opportunities to act. They work with decision makers and recognizing the harms caused by racism by engaging them in challenging conversations. They invite them to invest in healing from racism, making time for healing a priority, valuing and seeking cross-cultural leadership, and taking the time to build those skills in listening, slowing down the process for better engagement opportunities, and being a true partner for their long haul. An example is the work that Hope Community was doing in their Parks and Power team. They work with the Minneapolis Park System board to build a sustainable environment for advancing a racial equity plan for the Minneapolis parks. They started by building strong relationships with the park staff and their leadership. The Minneapolis Park System board was working on introducing a racial equity action plan. Parks and Power convinced them to slow down their process to develop a more inclusive and broader engagement and a deeper understanding of racial implications. The Parks and Power really wanted the plan to move from operational to inspirational. An operational plan is a plan that is on paper and that we all need to do because it's coming from leadership. And an inspirational plan is a more actionable plan. Staff know their role, they understand the importance, and are ready to implement it. Building decision maker capacity is part of the invisible work. It takes a lot of time, and it takes an emotional toll from everybody, but especially from the Parks and Board staff. But they believe this work is necessary for creating an ecosystem of support and sustainability for the implementation of the work and its long-term goals. Next slide, please. Our fourth strategy is transformation for racial justice. All the three strategies that I talked about, activating community leadership, building power collectively, and building decision-maker capacity, are working towards equity that impacts racism in multiple ways. Transforming for racial justice is both a strategy and a goal. The Health and All Policies funded communities spoke boldly on racial injustice. They held space for brave conversations on race, told their stories, educated themselves and decision makers on historical origins of inequities, named white supremacy and structural racism. They built healing justice into the work, deepening their relationships with community, prioritizing time and space to explore healing, creating space for dialogue, and building intersectional teams. They transformed decision-making by slowing down timeline to allow authentic engagement, build transparency of how resources could be used differently, prioritizing community ideas and solutions, and treating people with respect even when there were disagreements. Funded communities use these 4 core strategies to develop an ecosystem approach to gain a deeper knowledge of how the system works and institutionalize the use of racial equity lens. Next slide, please. We will now watch a video of the work that Voices was doing in Worthington, Minnesota.
Great. Timing is good too.
Thank you. Next slide, please.
Hang on just a second, having another quick technical difficulty, but we'll be on in just a minute.
Thank you. There we go. Thank you. So in conclusion, we learned that a community-led health and all policies, it's work that is effective to do policy systems and environmental change. This initiative led to 20 documented policy and practice impacts in metro and rural Minnesota, directly addressing the social determinants of health, contributing to better people's long-term health, which contributes to chronic health conditions and high healthcare costs. Some of these examples of these policies and practices are new and increasing access to housing for low-income people, more resources for parks serving people of color, active city human rights commissions that supported immigrants, city planning officials incorporating equity language and criteria in decision-making, health systems and schools using equity criteria, and deep partnerships with food procurement and education between local Hmong farmers and early childhood care providers. Now I'll pass it back to Sue.
All right, thank you, Anna Isabel. It was really quite amazing all that was achieved and some really powerful outcomes.
Especially in 3 years.
Especially in 3 years, that is, and in some very small communities as well. Next slide, please. So this initiative, as I mentioned before, was transformational not only for the communities but for the Center for Prevention. It was really interesting as a project manager. Early on, our community partners were asking, what are you doing to influence policies and decision-making in Blue Cross? Yes, as the largest health plan in Minnesota, we too were a partner and a target. We were just 1 year into the project when we were looking for ways to influence decision-making. We could see that this was the right work and it was being done in the right way, centered in community. So we began to develop a plan to strategically share our experiences and findings from the project with both internal and external audiences. We successfully influenced and helped shape our new strategic plan in the Center for Prevention. One of the outcomes of the plan is a strategy around building community power, and another is engagement of systems partnerships. We're intentionally working to contribute to the field by doing presentations and sharing our findings with other funders and organizations. And we don't always do this in the Center for Prevention, so it's really helping us to get the word out. And it's why we're here with you today. The experience with HiAP has changed our staff, how we do our work, how we fund communities, and how we will evaluate future projects. It's also contributed to the equity integration plan within our company. Next slide, please. As you can come to understand, that this was really a mutually beneficial relationship with the organizations. We actually looked to our funded communities to provide us with recommendations to share with other funders and mainstream organizations. You can imagine they had a lot to say. But I'll try to be brief and highlight some of the most important pieces. They mentioned that communities can identify and prioritize the policy changes that are important to them. This is key. That by supporting community leaders and community engagement activities, it not only assured that their voice was heard, but it influenced what decisions were made and by whom. Our funding was flexible and resources shifted as plans evolved. It was important that we also let go of timelines and allow the process to slow down and to be successful. And as you saw when Anna Isabel was talking about decision maker, it's important that we built decision maker capacity so that they could recognize how their decisions and policies impacted the people experiencing the greatest disparities. Lastly, our partners strongly encouraged us to become leaders in influencing other funders and mainstream organizations, and to continue conversations around racism and efforts to build community power. And our last slide. We'd like to thank you for joining us today, and there are several ways that you can connect with the Center for Prevention to find out more about our work. And with Rachel's help, we'll take some questions. Thank you very much for being with us.
Thank you.
Thank you so much to our presenters for the wonderful presentation. It was so informative. If you have any questions, we'll be taking a few for the next couple minutes. You can submit them in the questions panel, and we will go through and answer a few of them. So to start, our first question for the presenters from one of our attendees. In the implementation process, did you develop a set of shared outputs/outcomes that you aspire to in the HiAP work?
Thank you for the question. We really just wanted to have community lead the process with us, work with them defining what were their targets and what were their goals. Obviously, knowing that a health and all policies addresses health, but we didn't have specific goals that we wanted them to work on. We just worked on it together to figure out what that looked like.
Wonderful. Another attendee asks, considering how successful the initiative was, are there any plans to scale this model to additional organizations and communities across Minnesota or even the country?
Well, we do just only work in Minnesota, but does not preclude others for reaching out to us to learn more about what we've done so that we can hopefully share our experience and expand it across the country, because we really do feel very strongly that this community-led approach is very successful. We have, as I mentioned, our new strategic plan utilizes some of these strategies and encourages. We have just opened up a new round of funding, and we will be supporting ongoing projects such as this that will take this type of approach.
Another one of our attendees has a question about what specific metrics and indicators did you measure for this project?
So the evaluation had a couple of, every organization, they developed their own goals, and then we were tracking either monthly or quarterly and how they were doing with achieving their goals. And it was mostly qualitative work that they were doing. They met with the evaluator over the phone to track how is it that they were doing with their goals. We also had interviews with their community partners, community leaders, and decision makers. And we also will have annual listening sessions. We'll meet with each of the organizations to have time to reflect and analyze how are they doing with their goals. That also provided an opportunity for them to say, this goal is working or it's not, and how could they pivot and go in a different way. We did have evaluation questions around how is it that we're impacting decision makers? How is it that we are impacting policy? How is it that we're addressing race? And how is it that is community organizing a key part of the work that we're doing? So there was broadly the things that we wanted to learn. And each organization was able to track their own goals, and then we actually made a profile for each of the organizations, talking about their successes and outcomes.
Another one of our participants asks, with working with different types of organizations, from community-based organizations and city agencies partnering, how do all the different groups, agree about the inequities you are working towards fixing, and how do we have differences of opinion, and how do you navigate those?
I don't know if I fully understand the question, but I think each organization was able to do that on their own. So they were the ones who targeted each of the institutions they wanted to work with, like HoPE was working with the Minneapolis Park System Board, ADA was working with the City of St. Paul. They didn't necessarily have to have the same narrative or message among each other on what they wanted to target, just understanding and using a health and all policies approach to the work that they're doing, knowing that a lot of the work that we do in the community affects health in different ways.
And I want to emphasize that it was unique to that specific community and that specific organization that they identified. And I think there was in a couple of instances, there may have been a common target, like say the city of Minneapolis, but it was different entities within the city that were the targets, and that the community organizations were partnering with or identified specific decision makers within that particular subset of the city or agency.
Yeah, I think it's really that we were working in a different way, just really recognizing that the solutions are in the community, like Sue said. So the solutions are in the community. We're gonna, provide them the opportunity to figure that out. Either they're already doing the work and they just amplify it, or they had the opportunity to just reflect and say, this is not the way that we want to work. We should work in different ways to be more effective.
And sometimes those plans changed, as I mentioned, and it may have been that they targeted, I'll think of one organization I work with, Among American Farmers Association, and they were targeting a healthcare system, Health East, in our community. And they started out with trying to change the procurement policy of the hospital, and found that, boy, that was going to be a big step. So they learned that they had to slow down and step back, and started a community-supported agriculture program, a VeggieRx program, with some of their clinics to bring fresh fruits and vegetables, culturally appropriate foods, to people that had identified having a chronic disease. So they started small. They started with 5 shares, and that expanded to hundreds of patients, and it evolved into building that relationship and taking the time to understand what it was going to take to impact the broader big food system within the hospital and the clinics.
Great, and I think we have time for just one more question. What would you recommend as a first step in working towards healing justice?
That's a great question.
It is.
as a first step of working into healing justice.
Find an organization in your community that does this well and is completely aware of the strength and power and impact of engaging in that type of process. What would you say?
Yeah,
Ed?
I agree. I mean, Hope Community was one of the organizations that really used this as a core strategy of the work that we're doing, and they had, they talked with leaders in the Minneapolis Park System board, and they had trainings on somatic healing, and it all comes into understanding that, when we talk about race, we all have different reactions that our body comes with. Either you're white, African American, Latino. So it's just even like understanding that what is happening in our own bodies when that is when we're talking about race, and building into a space that we actually can be listening to each other. So first, like trying to figure out what is happening and how can we actually be open to listening and understanding of each other. So I think that's a good point, just finding another organization that is doing this, learning from them, and then diving into doing it together.
And I think we're of the mind that this is just a key strategy that's emerging and is really, in some cases, it has to be the first step in order for people to move on and to move forward.
Wonderful. I just wanted to thank our presenters again for sharing their expertise on the health and all policy initiatives, and particularly their work in Minnesota and in this community. A few housekeeping things before we totally wrap up. As you can see on this slide, it has different ways to connect with the Center for Prevention, including Sue and Anna Isabel's emails, as well as their website link. These slides, as well as a recording of the webinar, will be posted on the Root Cause Coalition website under our webinars section. And if you have any questions for the Root Cause Coalition or any of our presenters, feel free to contact us. Thank you so much again to our presenters and for all of you for attending today. We look forward to seeing you at our next webinar. Thank you so much.
Thank you.
Thank you.